Hello. Hello.
Hello. Yes, sir.
Yes. Are you getting any picture?
Yes, sir. Endoscopy picture we are getting, sir.
And what you see there behind?
Yes.
Adenoids.
Yes, sir.
So this child was posted for adenotonsillectomy. Tonsillectomy has been done, and I am showing some surgical steps of adenoids here.
Yes, sir.
So adenoids are not actually tumor. This is hypertrophic lymphoid tissue, basically. And once you do a comprehensive adenoidectomy and treat allergy, because allergy is always associated with adenoids.
Yes, sir.
Allergy can stimulate the hypertrophy of the lymphoid tissue, causing adenoid enlargement, or adenoid enlargement aggravate the allergy at the same time, both. So, the comprehensive treatment involves a proper adenoidectomy followed by allergic treatments. And see the picture. This is after decongestion.
Yes, sir.
So our adenoidectomy involves comprehensive, complete removal of the lymphoid tissue with preservation of the surrounding structure at the same time. Find out. And our technique involves preservation of the tissues is important for the good outcome, and prevention of complete removal is required for the prevention of so-called recurrence, because it is not a tumor. So quickly, what I'm doing, I'll be using coagulator and debrider both.
Yes, sir.
The reasons I will tell you. The first thing I'm using 0-degree telescope from the nose and red 60 blades from the oral cavity. Can you see?
Yes, sir.
And what you see on both sides, the Eustachian tube,
Yes, sir.
cartilage,
Sir.
the torus.
Yes.
So in the first phase, I will complete this in 3 phases. First phase will involve quickly the gross removal.
Yes, sir. Sir, have you done any?
This involves little bit of bleeding also, as we are not using coagulator. We are
Yes,
using
sir.
debrider. See this quickly,
Yes, sir.
as fast as possible.
Yes, sir. Sir, have you
Remove
used
the
any decongestion, sir?
Yeah, topical. Just simply pack of saline adrenaline.
Okay, sir.
I don't know somebody packed or not. I asked for. See this?
Yes, sir.
This is gross removal to open up the airway.
Yes, sir.
This finish as fast as possible to minimize the bleeding,
Yes.
because sometimes these are young children. See, this is gross removal
Yes, sir.
and the airway has been opened.
Yes.
This is the first phase, you can say, wherein you remove the adenoid grossly, not completely. And I will pack with the saline adrenaline gauze for a while. अच्छा पैक नहीं दिया, बड़ा पैक दे दो मोटा, not the pack. And we'll show you. We'll just put a pack from behind
Yes, sir.
for a few seconds for the surface decongestion.
Yes, sir.
This pack is for surface decongestion.
What is the position of the patient, sir? Same as
The
tonsillectomy?
same. Like no, not tonsillectomy. Like sinus surgery position.
Okay. Okay, sir.
We are using 0-degree telescope from the nose.
Yes, sir.
See, I remove the pack immediately. Not for longer point down. नीचे डालना काउच. हाँ. Yeah.
So lifting of soft palate is not required, sir, by any suction catheter or something like that.
Most of the time doesn't. You don't need most of the time.
Yes, sir.
And see this? This is the initial picture after the first phase, curve section.
Yes, sir.
That is gross removal.
Yes, sir.
My second phase will involve complete removal in the midline in the perimysium plane. Perimysium plane means,
Sheath over the muscles.
yeah, see this adenoid tissue situated on the posterior wall
Yes.
above the muscle.
Yes.
My second phase will involve removal in the perimysial plane. Just we'll wait for a minute again. Leave this back for a while for decongestion, further decongestion. See that?
Yes, sir.
Other side a little DNS. You can see from the other side as well.
Yes, sir.
And I can remove this remaining one.
Yes.
The torus also. This is again the same thing. The gross removal being done.
Yes.
Many people do this adenoidectomy and come away, and since the airway opens up, patient do well.
Yes, sir.
But for long term, we have to do something more. For long term, for prevention of so-called recurrence, because this is just lymphoid tissue. If you remove the adenoid completely, no question of, secondary bleeding or hemorrhage or anything exists. So, adenoid tissue should be thoroughly addressed. Straight section.
Sir, is there any pre-operative medications or preparation we can ask the patient to do?
I gave them mometasone spray for a few months. You can give Montelukast, which is something which acts on lymphoid tissue.
Yes, sir.
Montelukast is known to reduce the lymphoid hypertrophy. Wow. Wash. ये मेरे को दे तो section. And now see. This is the picture after the first phase.
Bleeding has stopped automatically, sir.
Yeah, reduced significantly.
Yes.
See this?
Yes, sir.
Now my second phase will start. Now the second phase will start and involves complete removal in the perimysial plane. That is the key.
Yes.
See this? The oropharyngeal mucosa,
Yes.
using the red 60, facing the surgeon. I told you we condemn using the adenoid blade for the adenoidectomy because that is a rear facing blade.
Yes, sir.
See, the blade is, the cutting edges are away from the muscle behind,
Yes, sir.
and adenoids are jumping into it.
Yes, sir.
See the perimysium plane behind.
Yes, sir.
See the perimysium behind.
Yes.
If I use the cobbleter here, it will end up charring the entire perimysium and the muscle underneath, which we don't want.
Yes, sir.
Our goal is to remove the adenoid without damaging any surrounding structure.
Yes.
See the adenoid being removed in the midline in the plane section. Now, as you go up, the muscle ends.
Yes, sir.
See my plane? This is complete adenoidectomy in plane.
Yes, sir.
And see above here, I have no fear of damaging muscle now.
Yes.
Above the periosteum and the basic occiput underneath. I
Yes.
can comb with my debrider hard here. Periosteum will not cut. It is tough. It is resilient. It doesn't come under debrider. And I can completely, cobbleter. Cobbleter. See this combing. Combing.
Yes, sir.
If some vessel comes, you can take the help of the. Then only the cobbleter is required. Give me divider again. Wash करता है. फूट जाता है. Wash. Wash. Third one. See this. Wash. Here I am still combing the adenoid tissue above with the debrider.
Yes.
See this?
Yes.
In this, you have to comb hard. Any soft adenoid tissue will come above when there is no muscle. Only the periosteum will be left behind. And there is no fear of, anything damaging over there. There is no muscle. Muscle is here. See mobile?
Yes, sir.
Here it is basic occiput. You can comb it hard without any problem. And see complete clearance of the adenoids from that region. What you are leaving is only the periosteum.
Yes, sir.
And again, I'll pack for a while. Section go. नीचे. Just for a while we'll pack and then you'll see the complete clearance from the midline. Pack and it's dry.
Yes, sir.
Few seconds and this will be the second phase. Over, we'll see any oozing, we'll coagulate. And the rest of this muscle, we will leave, we will not coagulate the perimysium and the underlying muscle. That is the key to protect.
Yes.
The whole idea behind, tolerating this little bit of bleeding is to protect the perimysium. Had I used the coagulation, I would have charred everything, the perimysium and the muscle, in order to remove the adenoids completely. That is something we don't want,
Yes.
because the end result will be amazing if you don't char the perimysium.
Yes.
Now see. Now see. Later. See the adenoidectomy now.
Looks almost complete, sir.
Now, this muscle, see this perimysium,
Yes, sir.
this should be protected. The underlying muscle should be protected. That's why I didn't use the coagulator over here.
Yes.
Had I used the coagulator, this wouldn't have been. See now, no more bleeding.
Yes.
The beauty is we didn't char the perimysium. That is what something wanted.
Yes, sir.
See this?
Yes.
The entire perimysium and the underlying muscle is absolutely free.
Yes.
Find out. Absolutely free. Now, since the muscle is there, yeah, since the muscle is there, underlying muscle is there, and the facial layer is intact, there is no question of secondary bleeding from here.
Yes, sir.
Entire question of secondary bleeding arises in the above when there is periosteum. So what I will do, there is no muscle above.
Yes, sir.
I will do a carpet coagulation of the entire periosteal region.
Yes.
This will be a sort of carpet coagulation, but not over the muscle. We don't want the muscle to be charred.
Above the muscle.
Yes, superior to it.
Yes, sir.
We don't want to char the muscle, and below is the muscle there to contract if any bleeder is there. You hold.
Hello. Hello, OT. Hello. Hello, OT. Hello.
Lovey.
Hello, sir.
Hello.
Yes, sir.
Yes, can you see me?
Yes, sir. We are with you, sir.
See after the second phase,
Yes, sir.
completely the panda is what all. See after the second phase, the adenoids are clear in the midline.
Yes, sir.
Our perimysium is completely intact without charring, and
Yes, sir.
periosteum is coagulated. Now
Yes.
in third phase, see these adenoids which I intend to remove now. Laterally place adenoid behind the torus.
Yes, sir.
And there is a lot of adenoid tissue still left behind. And see this region, to stay on safer side, don't do anything blindly.
Ji.
Just press on the muscle. See this. Allow the adenoid tissue to fall into the blade.
Sir.
Gentle, gentle. We are not poking anything blindly. See the amount of adenoids.
Yes.
This is fossa Rosenmuller, and see the amount of adenoid left behind. Yeah, please. Muscle will never jump into it, only the soft adenoid tissue will jump into the blade.
Yes, sir.
You can clear this area. See, only the soft adenoid tissue will fall. And my fossa is absolutely clear now.
Yes, sir.
There are two layers of muscles in the fossa Rosenmuller, a lot of adenoid tissue there. Check on the screen. Which has come out, and I will pack this for a while until I do on the opposite side to control this oozing. See this? And then you will see the surface. Fossa Rosenmuller.
Yes, sir.
Thus, that will control. So this is in fossa Rosenmuller, protecting the Eustachian tube and everything we have removed from behind. See this?
Yes,
This
sir.
is for laterally placed adenoid, and huge adenoids were left behind, and you can see again on the opposite side. This how much adenoid one can leave behind, causing the same problem. See this?
Yes, sir.
No movement should be blind.
Yes, sir.
Your blade should, cutting edges should always be visible, and allow the tissue to fall into it. Only the adenoid will jump and fall, nothing else.
Yes, sir.
See the entire fossa of Rosenmuller.
Yes, sir. This amount of clearance is not possible with curate, sir.
Impossible. Impossible by any other means. See the opposite fossa there.
Yes, sir.
And similarly, I will leave a pack here for a while. And then you will see both the fossa and the complete lymphoid tissue clearance. A comprehensive adenoidectomy is required to address this problem properly. See the opposite fossa?
Yes, sir.
Just leave it for a minute. See, as long as you don't poke your blade blindly anywhere, it is not going to harm anything. Rest assured. It is complete adenoidectomy.
Yes, sir. Beautiful, sir.
Important thing, the muscle should remain intact. If the muscle is damaged, when you use the cobbleter extensively, the underlying muscle gets charred, damaged, and then the nasal twang and torticollis, infection, all those issues come into play. See the complete of fossa of Rosenmuller.
Yes, sir.
Section लगा. So where to use cobbleter, where to avoid cobbleter, to avoid charring, everything is important. And complete clearance. See the fossa of Rosenmuller completely.
Beautiful, sir.
See the muscle there. Now to the opposite side. See the fossa of Rosenmuller opposite side.
Yes, sir. No adenoid left.
Absolute complete clearance of the fossa. Without damaging muscle, no adenoids, without damaging torus. Only adenoids removed, nothing else is damaged.
Yes, sir.
इधर
100% complete removal, sir.
So comprehensive adenoidectomy is required. Once adenoids are removed, chances of bleeding, secondary hemorrhage are automatically ruled out. It requires for patients to follow technique for complete removal rather than doing a half-hearted job.
Anything less than this is not the justice to the adenoid, sir.
This is what we believe. So this is complete comprehensive adenoidectomy. Give me a pack. Wash. Wash for 10 minutes. See the plane.
Beautiful, sir.
That is the perimysium. That is the torus on both sides intact.
Yes, sir.
Complete torus intact. Complete muscle intact. Complete fossa of Rosenmuller cleared. No damage to any surrounding thing. No charring of muscle or perimysium. It takes care of all possible, disadvantages by any other technique. All possible. You leave a pack and see after 10 minutes, and then it's almost done. Idhar dekh lena. And we'll come back after देख के पैक कर देना. Our assistant will be washed for 5-10 minutes and pack. So this was all about adenoidectomy.
Thank you, sir.
Any questions?